I'm Pete Szolovits. I'm a professor of computer science and engineering, and I'm also associated with IMES, which is the other institute that was recently stood up, Institute for Medical Engineering and Science. And I'm delighted at the opportunity to moderate this panel on healthcare and its relationship to the concerns of IDSS. Could I have the next slide, or maybe I have control? Yes. So I thought I would start with just a couple of comments that actually take off on the title of this institute, and these are kind of anecdotal. I joined the MIT faculty in 1974 as an artificial intelligence researcher and realized that I wasn't smart enough to do artificial intelligence research in the abstract, and so I needed to have some domain about which to think. And I met a group of doctors here in the Boston area who were trying to understand what medical reasoning was about, not because they wanted to automate it, but because they wanted to teach their students, their medical students, how to do it better and more systematically. And so we hit it off, and that became my career. But at the time, we had no data. So I remember joking that if one of my students had a good idea about how to represent some clinical decision-making problem, we would send him to the hospital, and he or she would pore through reams of paper records. And you know, if they came up with 3 cases where their idea worked, that was a good master's thesis. And if they came up with 10 cases in which their idea worked, that was a good PhD thesis. So this is slightly a joke, but only slightly. And so it was an era of knowledge-based systems, and we relied on extracting knowledge from the heads of human beings. So I would joke that I was working with Steve Pauker, a young cardiologist, and we would go into his office, which was in the bowels of Tufts Medical Center, and I would take a baseball bat behind my head, and I would threaten Steve until he divulged the secrets of what he knew about taking care of these patient cases that we were looking at. This is a very inefficient and very spotty way of gathering knowledge and building computer systems. So all of a sudden, about 20 years ago, hospitals began to have large databases, and so now we really are in an era of big data, and change the way that we go about trying to understand what the medical reasoning process and what the medical decision-making process is like. So that's data. And of course, you're hearing a lot of that in every domain at this meeting. My anecdote about systems is that when I got started, I was thinking to myself as a young, wet behind the ears professor, what's going to happen to this field over the course of my career, and in particular, over the course of the time in which I have to get tenure at MIT. And I figured that since there was no data, we were going to be very limited in our ability to analyze anything. But I also figured that by about 1981 was my estimate, tertiary care hospitals, like the big hospitals in Boston, would have electronic medical records, and then we would be in great shape. So how did I come to this brilliant conclusion? Well, I plotted the declining cost of disk storage of data against the cost of maintaining paper records. And sure enough, they crossed over in around the early 80s. So I was right, but of course I was totally wrong, and it wasn't until the meltdown of 2008 and the subsequent Recovery Act that invested $30 or $40 billion into bribing hospitals to buy electronic medical record systems. Sorry, I should watch my language when speaking with a government person. That finally this happened. And then the third thought about society, again reflecting my not quite naivete, is just yesterday I was talking to one of my colleagues who is a hardcore machine learning researcher. And she was saying, you know, if we could only gather all the data about all the patients who are suffering from certain diseases, put them in a giant database, then we have all kinds of analytical techniques to build at least empirical models and figure out what works and what doesn't, and we could dramatically improve the care of patients in the United States. And of course, technically, this seems to be true. Whenever we gather large sets of data about anything, we find that often it is possible to build fairly accurate predictive models. And so why aren't we doing this? And of course, what that idea discounts is the whole notion of privacy and of people's autonomy and their right to have control over their own lives and their own data. So that's certainly a societal problem. Okay, I'm going to get off the stage. I just wanted to introduce the panel. So DJ here defending the government from my slurs is the chief data scientist of the US, background in applied math. He had a very successful career in high-tech industry. I love the Yahoo's description of him as Obama's big data dude. John Halamka is CIO of the Beth Israel Deaconess Medical Center and a professor at Harvard Medical School, now an endowed professor at Harvard Medical School, so they can't fire him.
Title in lieu of pay.
So I've known John for a long time because besides his MD, he also got a master's degree in medical informatics and did his research in my lab. And he's also an organic farmer, which is kind of cool, and writes a really wonderful blog, which is referenced there, that I recommend to people. Deborah Estrin with the cool shades.
Where did you find that picture? Use them right now.
I found these on Google. Deborah's a professor at Cornell Tech in New York City. What?
Just wait till the next time I'm introducing you.
And I've also known Deborah forever. I was one of her torturers when she was doing her oral qualifying exam as a doctoral student here. And in fact, when I had just graduated from high school, I worked as a programmer at UCLA. And I remember competing with her mom for computer time on the big mainframe computer that we were all using. And Elazer is a professor of health sciences and technology at MIT and a professor of medicine at Harvard Medical School. And I've known Elazer for a long time also as colleagues in the HST program. I forgot to say, I didn't know DJ, except we do have a connection, which is that his dad was a colleague on the faculty here when I came to MIT, and his uncle became one of my first graduate students, so we have a family connection. So with that, let me turn it over to DJ,
okay,
who will give the keynote.